the hidden root cause of high blood pressure nobody talks or cares about, and how to fix it naturally. Introduction: the vascular root cause of hypertension. Why this is rarely discussed. High blood pressure is usually treated as a number. Patients are given medication to lower the number, but the root cause inside the blood vessels is often not discussed. In reality, hypertension is primarily a vascular disease, not just a heart problem. Blood pressure rises when blood vessels or lose flexibility, constrict abnormally, become inflamed, become stiff, lose nitric oxide signaling. All of these changes occur within the vascular wall. The blood vessel wall is not a simple tube. It has multiple functional layers, each playing an important role in regulating blood pressure. These layers include the glycocalyx, the protective sensing layer, the endothelial cells, the signaling control layer, the smooth muscle layer, the mechanical contraction layer. Damage to any of these layers can lead to hypertension. Damage to all three leads to persistent high blood pressure and arterial stiffness. This vascular model also explains related conditions: cardiovascular disease, kidney disease, stroke, microvascular disease, bronchial smooth muscle dysfunction, arterial calcification. So hypertension is not just a pressure problem. It is a vascular health problem. Why doctors rarely talk about this? There are several reasons. First, vascular layers like glycocalyx and endothelial function are not routinely measured in clinical practice. Second, medical treatment often focuses on controlling blood pressure rather than restoring vascular health. Third, vascular dysfunction develops gradually and silently, long before hypertension appears. Fourth, medications mainly act on heart rate, fluid volume, hormonal pathways, but not directly on vascular layer repair. Finally, lifestyle and vascular biology are often underemphasized in routine consultations. However, research clearly shows that vascular dysfunction precedes hypertension. Structure of this lecture series. To understand the vascular cause of hypertension, we will examine three layers. Part 1, glycocalyx. The protective sensing layer. Part 2, endothelial cells. The signaling and nitric oxide layer. Part 3, vascular smooth muscle. The contraction and calcification layer. Together, these form the vascular control system of blood pressure. Understanding and supporting these layers helps address the root cause of hypertension, not just the symptoms. 1. What is the endothelial glycocalyx? Inside every blood vessel is a microscopic protective layer called the endothelial glycocalyx. It is a gel-like, slippery coating. Lines entire vascular system. Acts like Teflon/nonstick layer. Thickness 0.5 to 5 microns. Made mostly of water plus sulfated sugars. Composition. The glycocalyx is made of heparin sulfate, chondroitin sulfate, hyaluronic acid, proteoglycans, syndicans, glycocalyx, found nitric oxide molecules. This layer is extremely delicate and easily damaged too. What does the glycocalyx do? It is not just a coating, it is a vascular control system. Major functions. 1. Maintains smooth blood flow. 2. Prevents platelet sticking. 3. Prevents clotting. 4. Releases nitric oxide. 5. Senses blood flow shear stress. 6. Prevents inflammation. 7. Controls vascular permeability. 8. Protects kidneys' microvasculature. 9. Maintains microcirculation. 10. Prevents atherosclerosis. This makes it central to cardiovascular health. 3. When glycocalyx is damaged. This is where disease begins. Damage leads to nitric oxide decreases if vessels become stiff. Blood pressure rises. Inflammation increases, platelets stick. Microcirculation worsens. Insulin resistance increases. Kidney filtration damaged. This contributes to hypertension, diabetes, kidney disease, atherosclerosis, heart disease, stroke, microvascular disease, cancer progression indirectly. 4. Root causes that damage the glycocalyx. These are modern lifestyle factors. Most important, glucose spikes, insulin resistance, inflammation, oxidative stress, hypertension itself, smoking, processed food, high fructose intake, chronic stress, sleep deprivation, aging, lack of sunlight/NIR. Even one large glucose spike can damage glycocalyx. 5. Glycocalyx and hypertension key mechanism. Healthy glycocalyx. Blood flow shear stress, nitric oxide, vasodilation, normal BP, damaged glycocalyx. No shear sensing NO decreases vasoconstriction hypertension. This is a primary upstream cause. 6. Other direct causes of hypertension. Glycocalyx is important, but not the only one. Major direct causes. 1. Nitric oxide deficiency. Leads to vasoconstriction, BP increase. 2. RAS overactivation. Angiotensin II constricts vessels. 3. Sympathetic overactivity. Stress hormones increase BP. 4. Arterial stiffness. Loss of elasticity. 5. Kidney sodium retention. Fluid volume increases. 6. Chronic inflammation. Damages endothelium. All of these also damage glycocalyx, creating a vicious cycle. 7. Glycocalyx and cancer. Indirect but important. Damage causes: leaky blood vessels, tumor angiogenesis, cancer cell adhesion, metastasis support, immune evasion. Cancer cells also modify their own glycocalyx to spread. 8. Can glycocalyx be regenerated? Yes, it is dynamic and reparable. Recovery time: partial, hours to days. Functional repair: weeks. Structural rebuild: months. 9. Foods that provide glycocalyx building blocks. These contain sulfated polysaccharides similar to glycocalyx. Best natural sources: seaweeds, wakame, kombu, bladderwrack, nori, Irish moss, active compounds, fucoidan, sulfated polysaccharides. These are closest to actual glycocalyx structure. 10. Supplements that support glycocalyx structure most direct. Glucosamine sulfate, chondroitin sulfate, hyaluronic acid, fucoidan, MSM. These resemble glycosaminoglycans, GAGs. 11. Foods that protect indirectly. These do not contain glycocalyx molecules, but protect and rebuild environment. Gel-forming foods. Aloe vera, fenugreek, flaxseed gel, chia gel, psyllium husk, okra. These reduce inflammation, reduce glucose spikes, improve hydration, support endothelial surface. 12. Vegetables that support glycocalyx best choices. A leafy greens, cucumber, green beans, beetroot, a garlic, onion, broccoli, bitter gourd, cabbage. These improve nitric oxide, endothelial function, microcirculation. 13. Fruits that help small amounts. Best. Amla, berries, pomegranate, apple, guava. Avoid large amounts. Mango, banana, watermelon, jackfruit. These damage glycocalyx via glucose spikes. 14. NJAR/red light therapy and glycocalyx. Near-infrared light supports. Mechanisms. 1. Releases nitric oxide. 2. Improves mitochondrial ADP. 3. Reduces oxidative stress. 4. Improves microcirculation. 5. Reduces inflammation. 6. Supports endothelial repair. This indirectly rebuilds glycocalyx. Your NDR sauna setup is ideal for this purpose. 15. Lifestyle factors that rebuild glycocalyx. Most important, stable blood glucose. Eat vegetables first. Avoid glucose spikes. NDR/sunlight exposure. Exercise, shear stress. Magnesium. Omega-3. Hydration. Good sleep. 16. Practical daily protocol. Morning, vegetables plus cucumber plus green beans before meals. Fiber/salad first. During day, hydration, 3 to 4 times per week. Seaweed small amount. Daily, NGAR/red light exposure. Optional, magnesium plus omega-3. 17. Root cause model of chronic disease of 5 foundational roots. 1. Glycocalyx damage. 2. Nitric oxide deficiency. 3. Mitochondrial dysfunction. 4. Inflammation. 5. Insulin resistance. All interact with each other. Fixing these helps. Hypertension, diabetes, kidney disease, heart disease, stroke risk, aging, vascular decline. Final takeaway. The endothelial glycocalyx is one of the most important but overlooked structures in medicine. Protect it in you. Improve blood pressure. Improve circulation. Improve insulin sensitivity. Protect kidneys. Reduce inflammation. Support long-term vascular health. This is true root cause prevention, not symptom control. Part 2. The vascular endothelial cells. The control center of blood pressure and chronic disease. In the first part, we discussed the glycocalyx, the protective gel layer lining our blood vessels. Now we go one layer deeper to the vascular endothelial cells, which sit directly underneath the glycocalyx. These cells are extremely important. In fact, many scientists now consider the endothelium as one of the largest organs in the body. What are endothelial cells? Endothelial cells form a single cell-thick lining inside all blood vessels. Arteries, veins, capillaries, kidney vessels, heart vessels, brain vessels, lung vessels. They cover over 60,000 miles of blood vessels in the human body. These cells are not just a lining. They are active regulators of vascular health. They constantly sense blood flow, pressure, oxygen levels, inflammation, glucose levels. Then they respond accordingly. They are the command center of circulation. Main functions of endothelial cells. 1. Control blood pressure. Endothelial cells release substances that regulate vessel tone. They produce nitric oxide, relaxes vessels. Prostacyclin, anti-clotting. Endothelium-derived hyperpolarizing factor, vasodilation. They also produce endothelin. Vasoconstriction. Blood pressure depends on the balance of these signals. Healthy endothelium equals relaxed vessels. Damaged endothelium equals constricted vessels. 2. Control blood flow. Endothelial cells sense shear stress from flowing blood. When flow increases, they release nitric oxide. Vessels dilate circulation. Improves. This is a natural automatic regulation system. 3. Prevent clot formation. Healthy endothelial cells prevent platelet adhesion, produce anti-clot molecules, maintain smooth flow. Damaged endothelial cells become sticky. Platelets attach. Clots form. This contributes to heart attack, stroke, microvascular blockage. 4. Control inflammation. Healthy endothelium prevents immune cell sticking, prevents plaque formation. Damaged endothelium attracts inflammatory cells, initiates atherosclerosis, promotes vascular disease. This is the start of cardiovascular disease. 5. Control vascular permeability. Endothelial cells regulate fluid leakage, protein leakage, edema, kidney filtration, a lung gas exchange. Damage leads to swelling, kidney leakage, lung inflammation, tissue hypoxia. Role of nitric oxide. The most important function. Nitric oxide is a powerful vascular signaling molecule. It relaxes blood vessels, lowers blood pressure, improves circulation, prevents clotting, reduces inflammation, protects glycocalyx, improves mitochondrial function. When nitric oxide decreases, vessels constrict, BP increases, inflammation increases, circulation worsens. This is called endothelial dysfunction. What happens when endothelium is damaged? This is central to many diseases. Hypertension, endothelial damage. Nitric oxide, vasoconstriction, vascular resistance. Result: high blood pressure. This is one of the earliest causes of hypertension. Cardiovascular disease. Damage leads to inflammation, plaque formation, arterial stiffness, clot formation. This causes heart attack, stroke, coronary artery disease. Endothelial dysfunction precedes atherosclerosis, kidney disease. Kidneys depend on microvascular endothelium. Damage causes: reduced filtration, protein leakage, glomerular injury, increased creatinine. Endothelial dysfunction is a major contributor to chronic kidney disease (CKD). Respiratory system. Lung capillaries depend on healthy endothelium. Damage leads to impaired oxygen exchange, inflammation, microclots, pulmonary hypertension, seen in chronic lung disease, severe infections, vascular inflammation. Endothelial dysfunction contributes to abnormal angiogenesis, leaky tumor vessels, cancer cell adhesion, metastasis, inflammation. Tumors hijack endothelial signaling to create their own blood supply. Brain and neurovascular disease. Endothelial dysfunction affects blood-brain barrier, cerebral circulation, leads to stroke, vascular dementia, cognitive decline. What damages endothelial cells? Most important causes: glucose spikes, insulin resistance, oxidative stress, smoking, hypertension, chronic inflammation, sedentary lifestyle, sleep deprivation, processed foods, excess fructose, aging. These lead to endothelial dysfunction. Can endothelial damage be reversed? Yes. Endothelial cells regenerate continuously. Studies show improvement within hours, nitric oxide, days, function, weeks, structure, months, vascular repair. This makes endothelial health a reversible target. Role of diet in endothelial repair. Best foods: leafy greens, nitric oxide support; beetroot, nitrate source; garlic, improves endothelial function; onion, quercetin; cucumber, hydration; green beans, low glycemic support; berries, antioxidant; amla, vascular protection; pomegranate, endothelial repair. Avoid sugar spikes, refined carbs, ultra-processed foods, supplements that support endothelium: magnesium, omega-3 fatty acids, CoQ10, L-arginine/L-citrulline, quercetin, curcumin, pycnogenol, resveratrol. These improve nitric oxide, mitochondrial function, inflammation, vascular tone. Role of exercise. Exercise improves endothelial function by sheer stress. Blood flow increases endothelial cells release nitric oxide. Best types: walking, cycling, swimming, light resistance training. Even 20 minutes improves endothelial function. Role of energy medicine, science-based. Certain energy therapies improve endothelial function. These include near-infrared light, red light therapy, sunlight exposure, thermal therapy, sauna, mechanisms, mitochondrial activation, nitric oxide release, improved microcirculation, reduced inflammation. These are supported by vascular biology research. Why doctors rarely talk about endothelial health reasons. 1. Difficult to measure clinically. 2. Not part of routine guidelines. 3. Focus on treating BP numbers. 4. Lifestyle medicine underemphasized. 5. Pharmaceutical model targets symptoms. 6. Endothelium repair is gradual. However, research literature strongly supports endothelial dysfunction as early disease marker. Final summary: endothelial cells control blood pressure, regulate circulation, prevent clotting, control inflammation, protect organs. Damage leads to hypertension, heart disease, kidney disease, a lung disease, stroke, cancer progression. But the good news: endothelial function can be restored through stable glucose, nitric oxide support, diet, exercise, NJAR therapy, anti-inflammatory lifestyle. Protect the endothelium, and you protect the entire vascular system. This is a true root cause approach to chronic disease prevention. Next, we will continue with part 3. Altogether, it will make a complete knowledge on the vascular cause of high BO, hypertension, as the root cause that most doctors do not take care about. Founder, Holistic Wellness Foundation. Impulse.